Good afternoon, and thanks for joining us for the County Executive's Weekly Media Briefing. Happy holidays to everybody. I'm Scott Peterson. I'm the County Executive Marc Elrich's spokesperson. On our media briefing this week, Marc is going to be joined by Dr. Bridgers, Dr. Davis, and Sean O'Donnell of our Health and Human Services. Without further ado, Marc, let me turn it over to you for your opening comments.
Yeah, thank you very much, and thank you everybody for joining me today. I hope you're having as happy a holiday as you can possibly have. And I'm sure that everybody out there shares continued concerns about the state of things in the world right now, since this is all coming home to us. And so a lot of us I know are having to deal with things closer to home. We're approaching the new year very quickly, and there is some good news. A new minimum wage for all of Maryland is going into effect January 1st. It's a little bit different here in Montgomery County, which I'm going to explain in a moment. So on January 1st, the state of Maryland will enact the Fair Wage Act. This law raises minimum wages to $15. It's an increase from the current statewide minimum wage of $13.25 for employers with 15 or more workers, and it's $12.80 for smaller businesses. As of January 1st, everybody goes to 15. It's a significant increase. It's well above the federal minimum wage that's been sitting at $7.25. It's just kind of an amazing number since 2009. This was Governor Moore's one of his first legislative priorities, and I really appreciate his leadership in this issue. I got to testify in front of Annapolis with him. Maryland's only the sixth state in our nation to reach a $15 minimum wage. And the enaction of this law is a little bit different here in Montgomery County than the rest of the state. Small businesses with less than 10 employees right now are paying $14.50 in Montgomery County already, and so they will go up on January 1st. Under county law, like I said, they would have reached 15 in July, so this accelerates it by 6 months. All other businesses in Montgomery County are already required to pay $15 or more. If you have a company with 51 or more employees, you're paying $16.70 per hour. And for companies with 11 to 50 employees, you're already at 15 an hour. Additionally, county law indexes the wage for inflation. So the minimum wage will continue to increase here. And that's fortunate for people. Unfortunately, the state law did not get passed with indexing. And therefore, our minimum wage will continue to be different from the rest of the state as we move forward. There are many rationales for this, and Montgomery County is not the only place that has a higher cost of living than most of the rest of the state. The idea that their wages aren't going to keep pace with inflation is not a good thing. It's a problem here, but it's not as bad as the federal problem, where if you're in a state where the federal rule applies, you're still stuck at $7.25. And that means that the value of that wage loses some of its value every year if inflation continues to go up, which of course it does every single year. Even at $15 an hour, which may have been a big help 10 years ago, it's not adequate to live in the DC metro area. And in the 60s, my father was a postal clerk who sorted mail down at the post office at Union Station, and my mother was a waitress, probably waitressed in every restaurant in Silver Spring. They were able to take an income of less than $6,000 and handle the house mortgage of around $122 a month. I think their house cost them somewhere around $20,000 for a 3-bedroom, 2-bath house. That tells you how far we've come from what's expected today. A $15 minimum wage produces an annual income of about $31,000 a year. And if a person spends 30% of their income on housing, which is the maximum that a person's supposed to spend, then they have a little over $9,000 a year to spend on rent, and that equals $750 a month. I know everybody in our audience knows full well that finding an apartment for $750 a month is not happening in Montgomery County. It's extremely difficult to make this work if you're single. It's pretty much impossible if you're a single parent with children. And even a dual income family at a $15 minimum wage would struggle to find housing. They'd be able to spend about $1,500 a month Most rents in Montgomery County are above that level. So it's a stretch for a lot of people to make ends meet, even at the minimum wage. Affordable housing is not just a house price problem, it's also a wage problem fundamentally. That's one of the reasons we index the minimum wage to inflation. We want to make sure it doesn't stagnate like the federal law. If you think of all the state and county and federal programs that are meant to address inadequate household incomes, and this county and the state and the feds have lots of programs that address people's incomes, you can quickly see that the price of a substandard wage has been pushed onto the government, and it's a cost that all of us are paying for. Just like we'd pay for it if we actually paid higher wages and had to pay a little bit more for things. We do this because the consequences of not doing it would create a social disaster and massively increase poverty. Not just increase the number of people, but it would actually deepen the poverty that people experience. Fortunately, most people are decent enough to accept the government has to provide a safety net, but people making higher wages would reduce the need for a safety net. The closer wages come to offering a sustainable income, the less resources, the government would have to put toward this. And I would happily pay a little more for things that are produced by poorly paid workers if I knew they were making enough to put a roof over their heads and support their families without additional support. And if wages were to change so that people could cover their basic needs, it would put the county in a position to take some of what we spend and redirect it toward childcare and healthcare, which are big costs, which are affecting not just low-income families, but even middle-income families. So a better wage actually means government could do better things with its resources, and all of us would benefit from it. And our current system is just not getting the job done. But raising the minimum wage to and above $15 was a long, tough fight. I remember doing this on the council. When I was a council member and I sponsored the bill to get it started, critics said it would hurt economic competitiveness and prices would go up and businesses would close and people would lose their jobs. I will point out that our unemployment is under 2%. We're at 1670. None of this nonsense is borne out. And other places that have raised minimum wage are finding the same thing. It actually puts more money into circulation. If you think about it, an employee who's making $7.25 has half the income of an employee making $15. And most likely somebody making $15 is out shopping more, buying more, dining more, and putting money back to the local economy, which means more people are getting employed. It's actually a net plus. So I think, doing what we did was the right thing to do, and I think it's made our county stronger. And this is about correcting an historic injustice. This wage was originally meant to be tied to inflation, and Congress decoupled it from inflation. And the impacts of it are not good for families, around the country. Less so here, fortunately, but more so in other places in the country. Minimum wage is ultimately about people being able to earn enough to put roofs over their heads and not having to choose between that and choices like putting food on the table or making medical visits. So this county continues to lead by example. I'm proud the state of Maryland is now showing the same initiative in providing more people a better life with a higher minimum wage. And I hope that at some point the state indexes their minimum wage so that it doesn't lose value, which is what will happen if they don't index it, increase it. I also want to take a moment to recognize a couple of pieces of state legislation that go into law next week. One is there's an expansion of the existing law prohibiting storing or leaving a loaded firearm where an unsupervised child would have access to it. Now, anyone caught will be charged a misdemeanor and a maximum penalty of $1,000. This legislation also requires the state to develop youth suicide prevention, firearms, safe storage information, and tips to the public on how to, how to detect cases where somebody may be exposed or have too easy access to gun, whether it's, children or whether somebody with access to a gun, what to do if they're contemplating suicide. It also provides grants to local governments, schools, and nonprofits to help communicating the information to people. And easy access to firearms, not just a public safety problem, it's a public health challenge. And we look forward to working with the state on this campaign to reduce firearms fatalities. I'm also glad to see the enaction by Maryland of the Trans Equity Act, and Medicaid will now provide gender affirming treatments to all Medicaid recipients, including transgender, non-binary, intersex, and other gender diverse individuals. It's an important law change for our LGBTQIA community, and I am glad that in a context of the culture wars against this community that has come from the right, including from governors of neighboring states, Maryland continues to do the right thing, and Montgomery County will continue to do the right thing. I want to talk a little bit about, what's going on in the end of 23 and going into 24. We've been thinking about our priorities for 24. You'll see a lot of that in the budget. But before we look forward, we just wanted to look back. And so you'll see my weekly video message this week. We're focusing on a lot of the great things we did in 2023 and some of the problems we still have coming from 2023. And so you can look for that in this week's newsletter on the county's YouTube page. But one thing that kind of has pushed itself above everything else is continuing to get people to work together as a community and to stop the rise in hate and bias attacks in our county. Since we saw fighting begin back in October, reported incidents have gone way up. An increasing number of people here are afraid of being yelled at or attacked because of how they dress or where they worship. Community leaders say even though the fighting is far away, it's having a deep impact here. And while hate crimes are generally up, anti-Semitism has seen a sharper rise than all the others, and it's even in our schools. I saw a statistic the other day where it appeared that between October of 22 and no, July of 22 and October of 23, anti-Semitism led with a 61% increase. There's a lot of hate crime, and didn't used to be that way. I think all of us who have been here a while know that this is not what we're seeing now is not typical of what we've seen in Montgomery County. I grew up living with anti-Semitism and witnessing the endemic racism in America. I grew up in the 60s, and I grew up in this county, the District of Columbia, till I was 10, but the county after I was 10. It was inexplicable to me then as a child, and it's inexplicable to me today. Maybe 20 years ago, the darkness seemed to be in decline, and it seems to have gone in the wrong direction now. Hating groups of people for how they worship or what color their skin is or who they love has no basis in reason. There is no rational way to get to these views. You can't reason yourself into this place of darkness. This is not how children are born, but they get inculcated in these poisonous and irrational views of their fellow humans by adults. And we need to be clear about this. This is not the normal growth of a child's mind. These are ideas that are being put in their heads, and it is not healthy for society. And I'd say the internet's only made it easier for people who want to divide us to spread their imaginary and exceedingly dark view of the world. But we're better than that. We have to be better than that. Montgomery County is fortunate to have the diversity we have. And over my more than 15 years as a council person and executive, many different groups have worked together, supported each other, and protected each other. And we have to rely on those relationships now. Our work on Interfaith Coalition speaks to our best angels, and we need not to descend into the worst of us. We're going to continue to lead this county in a way that encourages everyone to stand together and build a stronger community. And I implore everyone to speak out when they see injustice, be clear, and ask everyone to be the best human beings we can be. And don't stand silently by when you hear people saying things that are just nonsense, irrational, or hateful. On the COVID health report, COVID case rates over the last week have gone up more than 40%. Experts say the increase was expected, but still a sign that here and across the state of Maryland, we're seeing more people getting sick and needing help. We kind of foreshadowed this starting back in November. We kept talking about the more people are inside and the more we're crowded together and celebrating together, the more likely we are to see more cases of COVID, and it's pretty much bearing itself out. Flu cases are also on the rise, and RSV is also a concern, which helps explain the graphic I'm sharing here, where you see this general uptick in the various associated broad acute respiratory illnesses that are in Montgomery's hospitals. We are at the highest point we've been at for a while. Flu cases are on the rise, and as you can see on the right side, the red dots indicating that over the past few weeks, we're seeing a surge of emergency department visits at our local hospitals, far outpacing the activity that we've seen over the last 3 months. And that's important because when our hospitals get overcrowded, the emergency rooms overload, and it impacts the ability of them to develop healthcare to people who really need it. If you've got the flu or you think you've got COVID, if you're not experiencing a serious case or feeling seriously ill, doesn't necessarily require a hospital visit. If you have access to telehealth or a doctor outside of the hospital, you should take that course unless it's an emergency. I feel it's important to reiterate what we shared last week about knowing who to call when you see cold and flu symptoms. First call, primary care physician. They may be able to schedule a virtual visit or make a diagnosis remotely. Go to an urgent care center, increases your chances of exposure and transmission. The same is true for a visit to the emergency room. So if you don't need to expose yourself to lots of sick people, make the emergency room a necessary visit, not an optional, easy option to go to. We all should have COVID-19 tests at home by now. They're still available for free at libraries across the county. Federal government will also mail every home up to 8 free tests by going through covidtest.gov. And now I'm going to give my health team a chance to talk a little bit about what they're seeing before we open up for questions.
Thank you, Mr. County Executive. I'll be brief here, just sharing a few slides to provide some data on what we're seeing. To talk about the increased hospitalizations, we've seen here locally in Montgomery County, our hospitalizations go up during the past week by 25 new acute care patients for a total of 65. A lot of this is people will wait until to go to a hospital, but these are again, these are inpatients, so this is fairly significant illness. Looking statewide, you can see those numbers from last week. The acute care went from 343 up to 409 across the state. Again, if you see from the chart, both locally and statewide, we're at hospitalization numbers for COVID that we haven't seen since back in January and February of earlier this year. Our emergency departments, these are the daily numbers for emergency departments. You can see over on the right again, we've crossed 250 patients in one day across all of our hospitals in Montgomery County. Again, that's a number we haven't seen since back in late January of this year. And a lot of this is being driven by both COVID and flu. These are the Maryland numbers. You can see the dark orange here. The outpatient visits for flu are continuing to tick up, and the inpatient visits are also ticking up. So it's really a couple different respiratory illnesses. This is traditionally the flu season. Last year it came a bit earlier than many years. So, we're just warning people that there's lots of respiratory disease, even if you're negative on a COVID test. It could be influenza, or it could be another serious respiratory illness. We also want to highlight, we're continuing to work with our nursing homes and assisted living facilities, and we're happy to report a few more locations, Cedar Creek, Cedar Glen, assisted living as 100% of their residents, and more than 75% of the residents at Brightview, Grosvenor, Cedar Creek, Hillwood, and Ingleside at King Farm have also been vaccinated. So we wanted to recognize these long-term care facilities for the work they're doing to talk to their residents and ensure that vaccinations are available to them. And we recommend everyone gets the 2023-2024 COVID vaccine, but especially our seniors and those at greater risk for respiratory disease. At this time, I'd like to turn it over to Dr. Bridgers or Dr. Davis to see if they have any additional comments.
Good afternoon, Mr. O'Donnell. Nothing from me at this time, Dr. Davis.
Nothing additional, thank you.
Oh, thanks, everybody. And I'll now ask the media, if you have any questions, you could please put up your hand or, in the chat, or let me know if you have any questions. I will check in with anybody. Jay, thanks for joining us today. Do you have any questions, sir?
Oh, yes. Thank you for having me. Sir, could you talk a little bit about the impact on tipped wage workers? It's our understanding that they're also going to benefit in the start of the new year. And thank you for taking my question.
Well, there's a bill in Montgomery County that's going to look at increasing the tip minimum wage. But that bill they haven't taken action on that yet. So we still stay with the lower tipped wage than the minimum wage. There was an effort to pass it at the state level, and it didn't go anywhere at the state. So we'll see what happens in the council. DC has, already done this. And, we will certainly get an opportunity to see firsthand what the impact is in DC while we're discussing what's going to happen over here. I don't know what the fate of that bill will be. So we'll see what happens in January and February.
Jay, anything else? All right, thank you. Any other questions from the media? Elia with Moco 360, you need anything?
Nope,
Right.
I'm all good.
Oh, thank you, Elia. Appreciate it. Happy holidays. And Judy Hertz, do you need anything? Always thank you, Judy, for chiming on the media briefing.
Oh, you're welcome. I'm fine, thank you.
All right, happy holidays. And that's all the names I believe. Oh, Darcy, do you have anything, or are you good for now?
Yeah.
Oh, there you
Yes,
go.
I had a
See you.
question.
Okay.
You got me?
We
Yep,
got you.
go ahead, Darcy.
Yes. Good afternoon. Just throwing a question out there regarding pedestrian safety. We did have a woman, we understand an elderly woman, struck and killed last night over at Beers Mill Road. And, some numbers came out for DC and the metro area. Has just been a lot of pedestrian fatalities. I know there's been a lot of, work and discussion and trying to get some changes to area roadways and improve the safety. Just getting your thoughts about that and trying to improve the safety of the roadways in the area for pedestrians.
So I haven't gotten an official briefing on what happened last night, but it was a well-lit intersection. They have witnesses. The person was struck in the crosswalk, and it appears they were crossing against the light. And that's a pretty busy street. So not the best. If they were crossing against the light, that's definitely not the best thing to do. I mean, it's hard. There are a lot of things we can do to make people safer, but people need to make themselves safer. And crossing against lights at busy intersections is not, it's just not a prudent decision to make. I don't know any other way to say it. It's tragic when somebody dies, but, people have some responsibility for putting themselves unnecessarily at risk. And we'll know more when we get the full details and we get some kind of police report. But like I said, they've got witnesses who are actually there, and it's distressing. And I understand it was raining. I don't know what to say. It's sad and it's unnecessary, but I'm not sure there's anything you could have done to make the intersection safer if people aren't going to follow the lights.
Okay.
Thanks, Darcy. Anything else?
No, I think we're good.
All right, Mr. Lopez Caparo.
Good afternoon. Thank you.
Hey,
Mr. Executive,
I want to continue with this pedestrian
Right.
fatal accident. So we know there has been progress in some areas, in University Boulevard and Georgia Avenue, for example, but why hasn't the speed limit been lowered on the entire Bears Mill Road yet?
It's a state road. I think it should be lowered to 35, but I'm not sure that would have made any difference because of the cars were going through the intersection at 35 because they had green lights. I'm not sure that would have had an effect here. But as far as lowering it, I'm totally in favor of dropping the speed. I mean, I think all the speed limits in urbanish areas or even the suburban areas where you have a lot of pedestrian traffic ought to be dropped to 35. That would be fine with me.
Okay, and I have another question. This increase of the minimum wage could bring more workers to the county, and that help to the economy and the county?
Probably not, because the county is already, we were at 14.50. We were ahead of the state by $1.25. When it goes up to 15, everybody in the state's going to be 15. So it's no longer going to be Montgomery County at that wage level will be the highest. We will still have a group of people at 15 that's the same rate as the state. I'm hoping that this group will fall into the county's inflation adjustment policy. So starting in July, they should see an inflation adjustment. So we should be higher, but being higher hasn't necessarily brought us, more workers. Usually you need an employer to bring you workers.
Okay, thank you, and happy holidays.
Same to you.
Thank you, and happy holidays to you too. WMAL News?
Yes, hi, can you hear me?
Yep.
Yes, go ahead.
This is Julia Eisen with WMAL News. I have two questions. The first one being, Mr. Executive, if you could talk a little bit about the free fitness passes that are going to be offered for Montgomery County residents and how residents could benefit from that.
Yeah, well, so we made our gym programs free last year, and we're continuing it. And I think this is going to be the new norm. I mean, our budget has managed to survive making it free for 2 years. I don't see any reason to go back and start charging. And I feel pretty good about that. I know a lot of people feel that our rec buildings and services are paid for by the county, and we should, not have extra fees on it. So I'm happy to make this stuff available. And obviously it's a benefit to people. If you can go here, we have, a fair number of these scattered around the county. You don't have to join a club to get access to fitness equipment. And whether it's, a club or having to, pay the rec center to use the equipment. So now you've got an option where you don't have to pay to use gym equipment. I suspect we'll continue to see more people opting to use our facilities. I've been in a few of them. The equipment's pretty good. Looks like a lot of the stuff you would get in the gym anyway. So it's a good option for people.
Great. And then just second question, if you could just talk a little bit about what are some of your biggest hopes for the upcoming legislative session 2024?
Wow. More housing money and being able to direct some of that money to ownership. The state programs right now, pretty much forever haven't allowed nonprofits to access money to build ownership opportunities. And if there's going to be state money, we'd like to be able to use some of it to being able to support projects that'll bring ownership to the community, not just rental housing. So that's one thing I'm hoping for. I'm hoping that the state makes some fundamental changes in the way they tax. The way they tax. In Virginia, thank you for asking my favorite question. In Virginia, they have far higher taxes on commercial property than Montgomery County. I mean, far higher. And they're able to massively build infrastructure, which you can't do in Montgomery County because we don't have the funds available, and we don't have a tax mechanism available to do that. And so, my hope is we can adopt a system that's more like Virginia's. It's fair to taxpayers. It would actually free up some money in the capital budget if we were taking some of our capital projects that would have otherwise been funded by special taxing districts. If we took them out of the capital budget and fund them with special taxing districts, it would free up money for schools, which we have not been able to build on the same schedule as the school system needs them because we don't have adequate bonding authority to do that. It would help us with speeding up recreation centers and library renewals. Everything we do is pretty much in this county dictated by lack of resources, particularly on the capital front. And so to the extent that we're able to move some of the capital spending to the kind of districts that they use in Virginia, it would free up money and would have no impact on taxpayers. None of this that I'm talking about requires taxpayers to pay more. And there's some other things we may be asking for that would give us more flexibility. But, we need a fair tax system. And Virginia, everybody keeps saying, look at Virginia, look at Virginia. I like looking at Virginia because when the more you look at Virginia and the more you understand how they get their revenues, the more you realize how different Montgomery County is and what a handicap we've placed ourselves at by using the system we use today. Another example being in Virginia, they can have a different tax rate on commercial property than on residential property. In the county, in fact, in the state of Maryland, counties, unlike municipalities, have to have the same rate for commercial property as they have for residential property, which makes any tax increase a poison pill. If you wanted to do what Virginia did, they have a 12.5 cents on all commercial property for transportation projects. Montgomery County would have to create a 12.5 cent tax on all property, residential property and commercial property. So we can't do that. Those kind of tax increases on residents are out of reach. Whereas in Virginia, the taxes pay for infrastructure that can't be used for social programs, God forbid, or anything like that. It all has to be used to build infrastructure. They've outbuilt us on infrastructure. They've got a transportation system that's vastly superior to ours because they've been able to raise this money, and they have not raised it on the residents. They've been able to raise most of it out of these special taxing districts. So I tell my friends, if you like Virginia and you keep telling me, why aren't we like Virginia? I got a way to get like Virginia. It's called doing the kind of things Virginia does, because it gave them the flexibility to build infrastructure that we do not have in this county. And I'm not the only one. Every county executive, all the majors are looking for the same authority, because when the governor, said we're cutting, the transportation funding, everybody realized that there are no major projects that will occur any place in the state without state funding, which means, and it kind of made people realize what we've realized all along here, that we're wholly captive of what the state capital budget is. And we can only do what the state provides us resources to do if it's at scale. And Virginia is not captive of the state budget. Virginia can go ahead and build things and bond things because they have this other source of revenue. So when the plug got pulled on everything, everybody kind of looked around and realized we're all stuck. If we wanted to solve a problem this year, we would have to do a general tax increase on everybody to try to raise the money to do it. And everybody's probably has the same feeling I do, that those kind of tax increases on residents aren't going to happen. And so we'll continue to do nothing. Doing nothing is not a good economic strategy. Those are my two big wishes. I think I'd like to see more money into early childhood. We've continued to make those investments, but we could sure use some more help from the state. And we'd like the state to actually play a bigger role in helping fund Kerwin, because having come up with this brilliant plan in which the state was supposed to participate, and then discovering that a lot of this is going to be put on the backs of the counties, none of the counties are going to be able to sustain the kind of increases that Kerwin's looking for if we're solely responsible for funding them. So we need some decent funding coming from the state as well. So those are big ticket wishes.
Thank you so much for answering my question.
Thank you. Happy holidays. Jay Korf, back to you.
Oh, thank you, Scott. Just a very, very quick follow-up question. Mr. Executive, if you could elaborate a little bit on the scare tactics from, let's say, various restaurant associations. We're seeing it a lot in Washington, D.C. related to minimum wage being go up and tip this and that. You had talked about that very briefly. Could you just elaborate on some, like, are you hearing from restaurants, let's say in downtown Silver Spring, that are just going to suddenly shutter their doors or fire people? Is this really going to happen? Or do you
I haven't
think these
heard
are all scare
anybody,
tactics?
well, I haven't heard anybody say shutter the doors. I mean, I will say, people said this back when we did the minimum wage in general. We were supposed to lose all this business. People were going to shut down. That didn't happen. Didn't happen here. Didn't happen in Seattle. Didn't happen in San Francisco. Didn't happen anywhere because, like I said, all that money put into people's pockets just wound up being spent in businesses' doors. So it's a good symbiotic relationship. And nobody complains about corporate profits going up. Nobody complains about hedge fund managers insisting on 20% return on their investments. Nobody says we're going to shutter our doors if these people insist on making that much money. But as soon as it's working people trying to get a better shake, and you're talking about people earning wages at the bottom of the level, and you're saying, oh, I'm going to shut my business if this happens, it's like, that's pathetic. And it's not true. You should come up with more real things. What worries me is, tactics where owners may put on the menu, our people now make minimum wage. And people aren't going to do the math and say, what does a person making $15 get? And if they decide they're not going to tip because they suddenly think $15 is a good wage, it's not good. A person typically would make more than $15 if they were waiting multiple tables. The tips from 2 or 3 tables is far going to surpass $15 an hour. And so if the owners do things to discourage tipping, by acting like they're getting paid so much money you don't need to tip, that's going to be a problem. Or if they try to tack it on a bill as a separate charge, so that the restaurant patron feels like they're paying the tip. Now here's my extra charge. There are lots of things they can do to make this not work and to make it painful. I hope that some of them have enough of a moral compass to realize this is not a good thing to do. It's not going to kill them. And, all of us have been paying more for food, and because just the cost, what's happened with inflation in general. I'm still going out to restaurants. My friends are still going out. People are still dining out. I mean, we adjust to these things. It's not like it's going to break my back, to pay a little bit more to make sure a server gets a decent wage. And I still tip on if I go to a place with the service charge, I tip on top of the service charge, because I don't want anybody to think that's enough, because it's not. My 2 cents.
Thank you very much. Have a happy holiday,
You
sir.
too.
Appreciate you, Scott. Thank you.
No problem. Thanks, Jay. Darcy, back to you.
Just a quick follow-up question regarding the General Assembly priorities. A little while back, CASA came under fire for some comments made by their executive director regarding Hamas. And he since apologized for those comments, but there was some discussion of basically defunding CASA, stripping them of funding, whether it's state or county level. Just what are your thoughts on that? Do you feel like they should lose their funding, or do you still support the organization?
Look, I don't think they should lose their funding, for having said something wrong, which I agree was wrong. They do a lot of good work in this community. They've done a lot of this work for years. There is nobody out there who replaces with them or competes to work in this space. And I think, you have to recognize the good they do, not just what they said. And I will say, I talked to them after that, and then I tried to explain to them that you have to be more sensitive to choice of words. I mean, you don't have to agree with policy. That certainly cannot become a litmus test, that people have to agree with what anybody does. But you can't talk about things or use trigger words that imply that people are going to be disappeared, or they're not going to be, that the outcome means displacement of entire populations. That's not acceptable for anybody. And they used words that are taken in the Jewish community as implying that the Jews would be removed. That is not where you can go. And I think they understood it. I don't think they understood and thought about what the implications were when they said it.
Thank you.
All right, well, thank you, everybody. I don't see any more hands up. Just one last time, any final questions from anyone? Well, I don't see anything. So on behalf of the County Executive's Office and Public Information Office, just want to thank everyone in the media for coming to these media briefings all year. Also, thanks to the Public Information Office staff for putting these things together every week. It's not right for me to say the last words of the year. So Mark, before we sign off, you go ahead and feel free to say the last words of 2023 to our
Okay, I
audience.
hope everybody has a nice, fun New Year's Eve and that we all get into next year, which is more peaceful and a little kinder than this year has been. Like I said, I think everybody's feeling stress from the stuff that's happening, whether it's abroad or whether it's happening within our own communities. Nobody can be happy about, a lot of the circumstances that we find ourselves in. We just have to continue to do the work we're going to do to try to make it better, which is the only reason to be sitting where I sit is to try to make things better. If that's not why you're there, you shouldn't be doing this. So we're going to continue to work to make this county stronger and better. I hope you guys have the opportunity. And like Scott said, thank you, for coming and doing this. I don't think many elected people are getting up and doing weekly, press conferences and opening themselves up to questions the way we do in Montgomery County. And I think it's a good thing. And, I always encourage you to take advantage of the opportunity to ask questions. That's why I do this.
Thank you, everyone. Have a great 2024.
Bye.